ahead and introduce Minnesota Governor Tim Walz. Thank you, Teddy, and good afternoon, Minnesotans. Today is the day that we take time of contemplative reflection on Dr. Martin Luther King Jr.'s birthday to honor the man who inspired generations of Americans to build what he called his beloved community. Dr. King's vision was simple, eloquent, and beautiful, a world where all kids could grow up and thrive. He fought to dismantle racist structures, and he challenged each and every one of us to meet our fear and hatred with action and love. The world that Dr. King dreamt of, we're still working on, and that became more apparent than ever 2 Wednesdays ago. We must do everything in our power to come together as one community to deconstruct that racist generations of racism in our state so that every Minnesotan, Black, Indigenous, brown, or white, can be safe and thrive in all things they do. Today, we want to talk a little bit about next steps in our battle against COVID-19. Over the last week or so, we've had a lot of contradictory information coming out of the current administration, whether it be about prioritization of groups of vaccines or the simple allocation of vaccines and numbers. We're going to need more from the federal government. I'm confident that in the coming days, we'll start to see a change. We need not only more doses, we need clear and factual guidance around those doses, when they're coming and how they're coming. I joined a little over a week ago requesting the federal government stop holding back the second dose of vaccines. We were really relieved when they said they were going to do exactly that. On the same day, they said they were going to CDC change guidance to 65 and older. Unfortunately, a few days later, we all know that there weren't more vaccines. That reserve is exhausted. Pfizer has a recent announcement that currently have millions of doses on hand, and they just need them to be purchased and sent to the states. We need a clear federal plan. We know that the lack of one caused immense problems, whether it was securing PPE, whether it was setting up a testing program, or quite honestly, acknowledging the very simple things like mask wearing, social distancing, and hand washing that can slow the spread of this. The good news is that we never waited in the spring around our testing program. We were deliberate and built a robust infrastructure that was acknowledged last week as the best in the country. It will serve us well in this continued fight with COVID-19. The same thing will be done around a vaccine program. We'll continue to ask the federal government to release more. We have a robust system, and you're going to hear from CEO of Health Partners, Andrea Walsh, talk about what our healthcare systems are doing. We also know that in our long-term care and skilled nursing facilities that we're nearing the end of those vaccinations that were being carried out with a federal government contract directly to private pharmacies, Thrifty White, CVS, and Walgreens. But there's much that the state can do and much the state has done. What we are doing this week is trying to bridge that gap until we get that coherent federal policy, and also to do like we did with testing, to build the robust infrastructure that can continue to expand to address what we already know is going to be a continued fight against COVID-19 until we reach a critical mass of folks that are vaccinated. So we announced and are announcing now 9 community vaccination pilot sites around the state. Those are for 65 and older, and our early education, pre-K-12 educators and child care workers. I want to remind Minnesotans, they're going to be operating on a very small initial inventory of vaccines because that's all we have. You'll hear more about how this will be set up. It will be an orderly process through either calling or a website. Folks will be able to go to those facilities, fill out the necessary paperwork, and receive their vaccines, of course, free of charge, no barriers to anyone. The problem is that we literally have millions of Minnesotans, and in many of these sites, we're going to have hundreds of doses until the federal government simply moves faster. But this will set up a chance for us to validate these sites, much like we did with testing when the federal government promised us that everybody would receive a test and then did nothing about that. We've now made that a reality in Minnesota. We're immunizing for impact, which means people over 65 have suffered the majority of deaths, both in Minnesota and in the United States. I would ask folks that if you're healthy, you don't have comorbidity or other issues, maybe let your neighbors go. We're going to have cooperation around this, but we recognize that people want to get this done. As far as educators and child care providers, absolutely critical. As I've said, we get our children back in school. And you can't just send folks back if your teachers are sick and can't be there. So we need to make sure, especially our pre-K to 5 teachers are getting in and getting vaccinated. And I would note that the bulk of our child care workers are predominantly women of color. And we all know that they have been hit disproportionately hard by the pandemic. Again, the demand far outpaces our supply. But much like testing, where there were no states testing up to 5,000, we said we were going to get to 20,000. Now we regularly test up to 60 or more thousand per day in Minnesota. And the same thing will happen with the vaccination process. Tomorrow we'll open limited appointments to our pilot sites, and they'll be available, and we'll expand them as much as we can. Local public health and healthcare clinics are continuing to vaccinate healthcare workers and assisted living residents that were in phase 1. I'm excited to announce that we're nearly done with that portion of it, with the first doses in our skilled nursing facilities. And I would note this, that the residents taking the vaccines exceeds about 90%. As far as the staff working there, it's much lower. I would encourage folks, go out and read, do what you need to do. This vaccine is safe, it's needed. It will not only protect you, it will protect others, especially those working in long-term care facilities. So I would encourage folks to think about that and to try and go in and get your vaccine. We know we have to move more quickly as a nation. We have to move more quickly as a state. We have to move more quickly as healthcare systems because that vaccine doesn't do us any good if it's not in arms. So we're continuing to set that guidance. We'll get more information out about what the next step is once we have, and it sounds like within 48 hours, we'll have a federal plan. The incoming President-elect Biden has indicated that COVID-19 and the vaccine process is the #1 priority of their administration. That will be incredibly helpful, and Minnesota will build from that. So we're receiving about 60,000 doses a week. That's it. I would anticipate, and I'm going to turn this over to Jan Malcolm in a little bit, that there will be a lot more than 60,000 trying to get on our website. I plead for your patience. Once we get folks on, they get their dosages in an orderly manner. We may have to wait and come back till our next week of our next set of doses come. Our intent is to run these almost full time as much as we can. All of the logistics of staffing these, of the needles that are needed, of the PPE that is needed, all the paperwork and the inputting of the data, all of those things are being validated and ready to go right now. And much like the testing program, we proved that we can do this as good as any state. And it's a long haul here. It's not how many doses were given in the first 15 days. It's how many doses that we can get and expand as quickly as possible to reach the critical mass. So here's the good news, Minnesota. Every single day, we're one day closer to ending this pandemic. And every single shot that gets done on this vaccine is one day closer to protecting not only the person receiving the shot, but all those around them, especially our most vulnerable. And with that, I'd like to, before I turn it over to Commissioner Malcolm, note that the team at Minnesota Department of Health have been working almost literally round the clock, planning this for weeks. And they were planning based on, again, as I said, faulty information from the administration, but it does not change our commitment or our ability to be flexible and to be able to scale up once we start to see a dependable federal partner. And with that, Commissioner Malcolm.
Thank you, Governor Walz. Good afternoon, Minnesota. First, I just do want to say again how incredible it is and how fortunate we are really to be able to talk about the rollout of safe and effective vaccines less than 1 year. In fact, I think it's 1 year to the day that the first case of this new disease showed up in the United States. It's just a phenomenal scientific achievement. As the governor said, we now need to have a similar excellence in execution of getting the vaccines actually administered to our people. And as he said, also, we're all tired. We're beyond tired of this pandemic and the many devastations it has wrought on our loved ones, our health, our economy, our ability to enjoy so many of the things that we enjoy. And since early days, really, in the pandemic a year ago, even then, we began saying eventually vaccines would be the way that we would get the pandemic under control. We knew we couldn't stop it. We have worked hard to slow it down. But getting the pandemic behind us requires that we get the public to have immunity to disease, which happens either through too many people getting the disease, getting ill, potentially severely ill for a long time to come with unknown health effects out into the future. But preferentially and ideally, the majority of that immunity would come through vaccination, as has been done with many, many other scourges of disease over the history of our people. We've said for months that vaccines would be the exit strategy, and they're here now. The problem, of course, as the governor has said, is that we don't yet have anywhere near enough doses to bring the pandemic to a swift end. And we also need to just keep in mind that this nationwide, indeed global, vaccination effort for COVID-19 is the biggest of its kind in history. And it involves a lot of different partners, each of whom has a very important role to play. And we literally are in a race against the clock, especially as we know now about the new variant of the virus, which has potential to spread much more easily and quickly. So these partners, and you'll hear from Andrea Walsh of Health Partners. I want to just thank right now all the partners all over the state, local public health partners, healthcare delivery partners, and our community partners who are going to help us get the word out and get this vaccine administered to make the most impact we possibly can. As the governor has said very clearly, we clearly depend on the federal government first and foremost to give us the necessary doses of vaccine, but we also need them to provide the kind of funding that will be required to administer the vaccine, to set a clear outline for the national strategy and to offer consistent guidance on key questions about the prioritization. That's what's been lacking, and that's what we're looking forward to in the days to come. The state's responsibility, by state I mean the State Department of Health, is to take that federal guidance and translate it into an approach that makes sense for our state's population and circumstances. The State Health Department also places the orders for the doses that are made available by the federal government each week and makes sure that those doses are sent where they are needed within the state. It's the role of our partners in healthcare and local public health, along with a range of other vaccine administrators, to actually get the vaccines into the arms of eligible Minnesotans. And we're so grateful for the hard work all of these partners are doing, and especially those in the communities that you're hearing about today who are going to help us stand up these pilot sites, and in healthcare delivery who are working to expand their capacity to do more vaccinating as more supply becomes available. As the governor mentioned, and you all know from previous media briefings, we have been working very hard to develop a really thoughtful, phased rollout approach based on the approach the federal government said that they would be taking with respect to prioritization of certain groups in certain orders, and based on the recommendations from the CDC's Federal Advisory Committee on Immunization Practices and our own vaccine advisory panel, allocation advisory panel here in Minnesota, who have given generously of their time and expertise to help us try to add some additional detail to those rather broad federal prioritization guidelines. But as the governor said, in the last few days of last week, we saw some incredibly abrupt changes in federal direction on vaccine distribution. And that's the reason why we are not able to announce the full strategy for phase 1B today. We are waiting for some federal clarity on the next steps in that larger process. But as the governor said, we're not sitting still. We are moving in the direction that we know the next waves of prioritization will go. There is broad consensus nationally and in the public health community of the value of vaccinating Minnesotans 65 and up, educators and child care providers as a next set of people to take advantage of the doses of vaccine that we do have. Now, as the governor said, with these two populations, or three populations essentially that we're adding today, or did add last week, through guidance that clarified that providers, healthcare systems, local public health, et cetera, could begin to vaccinate Minnesotans 65 and up if they had available vaccine to do that, while still making progress on the 1A population, healthcare providers and long-term care residents and staff. But then today we're further clarifying where and how Minnesotans age 65 and up can be vaccinated, as well as educators and child care providers. So with these added populations, 65 and up, educators and child care providers, and those that are in this next priority group, we anticipate that there will be well over 1 million people who will now be eligible for vaccines, each of them needing 2 doses to be fully vaccinated. Bear in mind, this is in addition to the 500,000 healthcare workers and staff and residents of long-term care facilities that we've been vaccinating in phase 1A since the latter part of December. But as of Friday, just to make a fine point on the math here, the Centers for Disease Control had allocated just under 627,000 total doses of vaccine to Minnesota, including about 109,000 that are reserved for the federal pharmacy program that the governor mentioned, where these national chains are helping to vaccinate long-term care facilities, and that the federal government runs that program directly. So clearly, not all the people who are eligible in the categories that we're talking about today, much less the broader 1B populations yet to be rolled out. Not all eligible people will be actually able to get a vaccination in the near future here. As Governor Walz has said, we desperately need more doses from the federal government and are frankly leaving no stone unturned to try to do that. But with the current imbalance between supply and demand, we just are going to all need to continue to practice patience, as the governor has said. So again, just because you might be in an eligible category does not mean that you're going to get vaccinated in the next few days. This week, a very few people in these categories, over 65, educators, child care workers, will start to be vaccinated. But for many more of us, there is going to continue to be a wait of weeks, if not longer, until the supply increases. At the current rate, we're getting vaccines from the federal government. As Governor mentioned, that's about 60,000 doses a week, and that number has not increased in recent times. We estimate it will take about 4.5 months at the current pace of dosage that we're getting from the federal government, about 4.5 months to get through this newly eligible set of Minnesotans. And I also do want to comment, though, that Minnesota's healthcare systems and physicians are eager and are working hard to build their capacity as well to help vaccinate all eligible Minnesotans against COVID-19. In addition to these community vaccination sites that we're talking about today, our healthcare partners and local public health partners are working hard to expand their capacity as well, so that when more vaccine becomes available, they will be able to help distribute it efficiently to their patient populations. But in their case as well, most community vaccinators, such as our healthcare providers, primary care clinics, urgent care clinics, pharmacies, and the like, do not yet have vaccine available for broad public use. And so if you have a regular source of healthcare, your provider is going to let you know when they have vaccine available for eligible patients. They are in the best position to identify those patients, reach out to them, and let you know if you are a patient with a regular source of healthcare, when you can start making appointments with them for a vaccine. And we'll keep the public updated on vaccine supply and priority populations. But because of limited supply, you do not need to contact your provider at this time. In fact, we ask and urge you not to deluge your physicians and others with calls about when you can be vaccinated. And we just don't have a large supply of vaccine to do that. So if you're a Minnesotan 65 or older who's eligible to receive a vaccine, you can, as the governor has mentioned, try to schedule an appointment through one of the 9 state sites that will be opening up later this week. There will be an online appointment system, a web-based system, and a phone call-in center that will open tomorrow at about noon. And a link to that website will be found on mn.gov/vaccine. And the phone number, the call center, will be listed there as well. And as the governor said, we're all just going to need to keep in mind that the very limited supplies we have mean that certainly there will be more demand than available doses. And frankly, we expect that the limited appointments available this week are going to be filled incredibly quickly, as we've seen in other places around the country. So people trying to schedule an appointment through the website or the call center will be notified when those appointments are filled and provided information on how to get up on a wait list. Now, for teachers and childcare providers, different from the over 65 population, for teachers and childcare providers, your school or childcare program will be working directly with you to schedule appointments, and you'll receive more information about that process from your employer. We don't want people to just show up at a state vaccination location without an appointment. There is no walk-in capacity at these sites. So we just don't want people to line up and then be frustrated that they're not able to get in without an appointment. Appointments are necessary at these sites. But we don't want you to lose hope either, because you can't get an appointment quickly. As the governor has said, this is a system that we're standing up, testing, so that we're able to run it fully efficiently when more vaccine becomes available. And more vaccine will become available in the coming weeks. As the governor mentioned, we are making good progress on the first phase of vaccination for healthcare workers, residents, and staff of long-term care. So as that program reaches completion by the end of this month and early into February, some of the vaccine that is dedicated to that program will become available. And as the governor has said, we have every hope and confidence that there will be more supply coming in the coming weeks and months with the new administration, and with more vaccines in the pipeline being developed. And as the governor has mentioned, the holiday that we celebrate today in honor of Martin Luther King Jr., it's important to just reflect on the fact that our planning has been very informed by our commitment to equity and to ensure that vaccines are available in an equitable manner for those populations in Minnesota who are suffering disproportionately from COVID-19 and then suffering greater rates of exposure, as well as more severe disease and poorer outcomes, in no small part due to just the historically structural and things that disadvantage certain groups in our community, and those experiencing health disparities that are just being exacerbated by COVID-19. So to that end, we will be providing vaccines directly to community clinics and federally qualified health centers, as they are in a terrific position to know and to serve these particular communities. We have a lot more work to do in this area. And here again, much depends on getting more vaccines from the federal government. But this equity consideration is so critical as we keep moving through the vaccination rollout. So I'll just reiterate again that we think that today's announcement is an important, good step forward in our state's approach to vaccination. And it's good news for the people newly eligible for the vaccines, but so dependent on being able to pick up the current slow pace that we're at is going to be dependent on the government's ability to ramp up that vaccine production. We are building this system, and our partners are building their systems to be ready to move quickly as we get more vaccine, and working to create new options for Minnesotans to be able to schedule a vaccine through a number of different distribution channels. So please keep an eye on the state's COVID-19 response website as this information is rolled out tomorrow and in the days to come. And with that, I'd like to introduce Will Phillips, who is our state director of the Minnesota chapter of AARP. Will.
Yes, thank you, Commissioner Malcolm and Governor Walz, and good afternoon. My name is Will Phillips, and I'm the state director for AARP Minnesota, a nonpartisan, nonprofit social impact organization with a member of nearly 640,000 Minnesotans over the age of 50. And without doubt, this pandemic has had a devastating impact on our members and all older Minnesotans. According to CDC, people ages 50 to 64 with COVID are 4 times more likely to end up in the hospital than their younger counterparts, and worryingly at 30 times greater risk of death. And if you're 65 to 74, the risks are even higher. In fact, the January 14th MDH weekly report shows us that out of 5,696 COVID-related deaths in Minnesota, nearly 98% of those were people 50 years of age and older. Some 89% were 65 and older, and 73% were 75 and older. COVID has ravaged our state's nursing homes and assisted living facilities. Isolation, long a problem for older Minnesotans, has become an even greater threat to the health and well-being of countless Minnesotans. And for older workers who have lost work, we know that the road back will in many cases be more difficult due to age and ageism. And all of this is why we've been calling on the state to prioritize older Minnesotans to receive a vaccine, and why we really appreciate the state's efforts to further prioritize Minnesotans 65 and over and support new guidelines to expand access to more older adults. These individuals must be given priority access to vaccines in addition to those individuals receiving care in nursing homes and other long-term care facilities that we've discussed here today. Also wanted to note that whether you're living in the community or receiving long-term services and supports in your own home, you should be able to receive a COVID-19 vaccine as well. Here in Minnesota, a significant percentage of long-term services and supports are provided in individuals' own homes. And we also strongly urge the state to prioritize the staff who provide care in these settings to receive a COVID-19 vaccine. Now, as we work to prioritize additional groups of people, we must ramp up production. And we strongly urge policymakers at the local, state, federal levels to immediately address whatever barriers may be causing delays in distribution and getting shots in people's arms here in Minnesota. And finally, we must ramp up our communication efforts. We're hearing regularly from our AARP members who are confused about when and where to get a vaccine and don't know where to go to get clear and accurate information. AARP has asked the state to regularly post information and updates on vaccine administration on a public website to ensure transparency and to provide critical information about when additional individuals will be eligible to be vaccinated. Our federal government, state officials, and the private sector must work together to be much more clear about when and how to sign up to be vaccinated and to efficiently manage the process to administer vaccines. And this pilot program that has been talked about today seems like a great step in the right direction. We all must be deliberate also in order to reach people who lack access to high-speed internet, who are not online otherwise, who have lost connection or become socially isolated in this pandemic, and otherwise populations who are at the highest risk of hospitalization and death due to COVID. We now have the hope of ending the pandemic through widespread vaccination, but for it to work, our state must make and implement plans that are guided by the evidence, and patience will be needed. It's time for full-scale mobilization. When we do that work well, we'll finally get back to normal. So thank you, and with that, I want to go ahead and turn it over to Andrea Walsh with Health Partners.
Thank you, Will. I'm Andrea Walsh, CEO at Health Partners, a health system providing care to over 1.2 million patients and 1.8 million health plan members. I appreciate the opportunity to be here today and to be part of this important public-private partnership that's so critical to our COVID response in Minnesota. At Health Partners, we know firsthand how important it is to offer a vaccine to every Minnesotan as quickly and safely as possible. We've seen firsthand what a toll the pandemic has taken on Minnesotans, our families, our businesses and schools, and our healthcare system. We also know that the state needs a lot of vaccine and many points of access to reach the nearly 4.5 billion adults who should get a vaccine. I appreciate the governor's support for a successful statewide vaccine strategy. We're all in this together. The three key elements for success are first, vaccine from the federal government to reach Minnesota. Secondly, appropriate allocation of vaccine by the state health department. And third, public health and health system sites that can quickly and efficiently vaccinate a lot of people. Today's announcement is an important step in creating additional points of access for vaccine, and that's a good thing. Our health systems must focus on vaccinating those at highest risk right now, especially the elderly, as Will just pointed out, who are at the greatest risk of death from COVID-19. We're grateful to the governor for allowing us the flexibility to begin these we're grateful to the governor for allowing us the flexibility to begin to reach these populations despite the limitations of vaccine supply to date, as the governor noted. The new public health sites announced today will add access for adults over 65, school teachers, and child care workers, and it's a complementary approach to the health system's capacity. I appreciate very much Governor Walz and Commissioner Malcolm underscoring the vaccine shortage. We're hearing from our patients and members at Health Partners. They want access to vaccine now, and we want to be able to provide it to them. It's pretty simple. The federal government needs to get more vaccine to the state so that the state can allocate more vaccine to the health systems. One thing Minnesotans should feel good about, our clinics and our healthcare systems across the state of Minnesota have what it takes to vaccinate a lot of people fast. Our infrastructure in Minnesota is one of the strongest in the country, and we stand ready to serve Minnesota and partner to get this job done. For instance, if we had vaccine full supply at Health Partners, we could offer more vaccinations in a single day than our current allocation allows us to offer in a week. It points out the shortage that the governor identified. We appreciate that this week Health Partners and other health systems will be able to begin to vaccinate high-risk patients as we can with the supply we have. It will be very limited, as mentioned by the commissioner. The upshot, and in conclusion, to state the obvious, Minnesota is ready for more vaccine. The health systems across Minnesota and this new capacity announced today by the state positions us well to distribute vaccine and put all of our capabilities to full use. We need more supply of vaccine to get that job done. Thank you, Governor Walz and Commissioner Malcolm. We're grateful for your leadership and your partnership. I'll turn it now back over to Governor Walz for the question and answers.
Well, Andrea and Will, thank you, Commissioner Malcolm. And I would just, before we take questions, I think Andrea summed it up well, that this is a robust public-private partnership, many points of access with a robust ecosystem and the ability to economy of scale to be able to scale up once the vaccines are available. We are not reinventing the wheel, and these state sites are not in any way meant to displace the already existing structure, whether you got your vaccine at the VA, you got it at a federally recognized health clinic, you got it with your provider, you got it at Indian Healthcare. There are numerous points of access, but we want to make that, as it was said about our testing program, the most friction-free way to get tested in the nation. And we would like that to be true with vaccines and to get it right. So the good news is Minnesota, we're prepared. These test sites are going up all across the state. Your providers, as you heard, are competent and ready to go. They know how to do this. We have a vast public and private health system in Minnesota that is the envy of a lot of the country. And now with vaccines coming, we can start to get at this thing. So, Teddy, with that, I would open it up for questions.
Thank you, Governor. Operator, we're ready for questions.
At this time, I would like to remind everyone, in order to ask a question, press star, then the number 1 on your telephone keypad. Again, in order to ask a question, press star, then the number 1 on your telephone keypad. We'll pause for just a moment to compile the Q&A roster. Your first question comes from the line of Mr. Jeremy Olson of the Star Tribune. Your line is open. You may ask your question.
Governor, my first question is any concern about this having a backlash effect? If people jump to the website, they can't get in, there's a crash or something, and it just gets frustrating. Is it worth putting 1 million people on alert that they might be able to get vaccine when they might just get frustrated when they're not able to get it and only a few hundred can get it?
Yeah, I'm worried about it, Jeremy. It's a good question. I think, yes, it's worth it because, again, we're bridging to what, we're anticipating what was rolled out by President-elect Biden, a very robust partnership with the federal government, the belief that they asked us on calls where I was on with his administration and other governors that they will be, if we have sites set up, they'll help us help us manage those. If the federal government needs to come in and set up large sites, they will do that. I do think it is, but I think you brought up a good point. I forecasted this last week for those of you listening. This is going to be harder than going to Ticketmaster and getting Bruce Springsteen tickets, because everybody's going to be right at 12 o'clock trying to get on. I would ask folks who know that you're relatively healthy, know that we're asking 65 and above. I would like to think that, if you know your neighbor's 80, try and get them on, get their in there. But yeah, it's worth it to do this, but it is not without its pitfalls. So one thing we want to be very clear of, we're not going to repeat some of the problems we saw, like in Florida, where they just said everybody show up, and we had seniors at 3 a.m. waiting in line and there's no vaccines. But with this much shortage and this much demand, there are going to be some frustrations and headaches. We've worked hard on the infrastructure around the phone system. I tested with my folks this weekend and asked them how many could be on. I did bring this up to note that there are some news organizations that refresh our website 90 times a minute to get new information on that. I would ask folks who have bots that are going to these sites to maybe think about holding and pausing those so that we don't get the overwhelmed site. But yeah, it's all going to be tough. My hope is, and I believe we've built a robust enough technology system. And again, recognizing a lot of folks who are seniors are going to want to call in. And boy, that's a frustrating situation, get put on hold for 45 minutes to be told there's no vaccine. So I'm going to beg for patience, but fully understanding people are going to be irritated.
And my follow-up question is, if you look at the state's data, the death rate among cases in the 60-year-olds is about 1.5%. In the 70-year-olds, it's 5.5%. In the 80-year-olds, it's 15%. There's more than enough demand just in the 70-year-olds and the 80-year-olds. Why did you not just cut it off there, as the ACIP recommendations did in the first place?
Well, they went to 65. I'll let Jan handle this one. 64% of our deaths fall because of the number of people that fall in that. 64% of the deaths fall between age 65 and 74. So, Jan, I don't know if you want to comment on this. This is a very robust debate, if you will, amongst people across the country as it deals with prioritization.
Thank you, Governor. Yes, I think one of the things that we've heard from our provider partners, and certainly, the federal government essentially made this decision last week by saying it should be 65 and older. And I think part of that was the desire to move more quickly, to have broader populations, more flexible for care systems and local public health to be able to serve broader groups. But your point's a good one. The advantages of taking, a more incremental, more strictly prioritized process of going through smaller populations first makes a lot of logical sense, but actually had a fair number of logistical challenges to it. So this is thought to be the way to capture the majority of folks who face these differential outcomes, as the governor has said, in a way that gives a little more flexibility to our vaccinating system.
Thank you.
Your next question comes from the line of Ms. Kate Raddatz of WCCO Television. Your line is open.
Thanks for taking my questions. Just my first one's probably pretty quick and just kind of a clarification. Governor, you mentioned that we're getting currently around 60,000 doses a week of the vaccine. Is there a certain number of those being allocated specifically for this pilot program for the educators, 65 and older, and child care workers each week, or is it just anyone who wants to get it from 1A and these new categories can try to have access to those doses?
No, it's a great question. There is an amount allocated. I think I'll let Jan get that. I think 12,000 is the number, but I would mention, and Andrea might want to fill in. That means that those are coming out of allocations that could go to other systems. So it's as if there's no more being added to the pool. This is just a different access point to add to that robustness. But the real fix to this is obviously more of them. So Jan, do you want to clarify the amount that is put into these pilot sites for this week? And again, this is flexible and able to be scaled up according to the federal government's allocations.
Right. As we've talked about before, the state gets an allocation and each week, or 1 week at a time, we know what we're getting the following week. And bear in mind, too, that we have to manage first doses and second doses. The 60,000 a week number is the first dose number. So far, we've been getting kind of a separate allocation each week for second doses, and we anticipate that will continue at least for a few more weeks, and we'll see what the future holds there. So, of the 60,000 first doses, the governor's correct. This week, 12,000 of that 60,000 is being distributed across these 9 sites based on population and workforce. And as we get through that, the amount of vaccine that's being directly allocated into the long-term care program, and as provider systems and local public health are able to work through their phase 1A populations, the healthcare workers and long-term care residents, then some of that supply that's going for those populations now, as Andrea mentioned, the systems will have flexibility to be able to do 65 plus with those doses as well.
Got it. Thank you. And then, kind of in addition to that, we're hearing about some of the numbers of vaccines that school districts are getting with the pilot program. Minneapolis saying they're getting 86, St. Paul 88. Obviously, teachers in those districts, many of them will be going back in person soon. What is your response to the teachers, Governor, who keep hearing about the number of doses that are available and asking, well, why not wait on sending the kids back in person until educators have more readily available access to a vaccine?
Yeah, well, one of the reasons is that we believe we've created an atmosphere, both using social distancing and the use of PPE and masking, modeling it on other workplaces that have a reduced risk, not zero, but a reduced risk of transmission, and the new data coming out, especially around K-5, which we prioritize, of transmission rates being much lower. I think I have Deputy Commissioner Mueller on here if she wanted to add any specifics around that.
Thank you, Governor. Yes, this is Heather Mueller. I'm Deputy Commissioner with the Minnesota Department of Education. And I would like to echo the Governor. We have put in place a number of measures to be able to help to support additional students coming back into the classroom and in-person learning. We have had a number of districts across the state, especially in greater Minnesota, who have been in person throughout the fall. But the addition of mitigation strategies, additional mitigation strategies, a testing program, increasing access to face masks and face shields, as well as looking at making sure that your cohorting students are all pieces that we were able to put in place to be able to do that. I think one of the other things that we know is that we partnered with the Minnesota Department of Health is that we also are looking at the other risks that we have to consider with students not actually being in school. We know the important role that schools play in the lives of students. So in addition to academics, they have their nutritional needs met, they have mental health needs met, social needs met. They also have their academic needs and as well as their mental health. And so there are more things to consider than just the academics, and being able to look at the data on K-5, the addition of the mitigation strategies as well as the testing program, rather than just giving us the confidence to be able to have more students coming back into the building.
Got it. Thank you.
Your next question comes from the line of Mr. Matt Sepik of Minnesota Public Radio News. The line is open. You may ask your question.
Commissioner Malcolm, I just would like you to clarify how far we are along with the 1A group, specifically first priority, second priority, third priority. And is everyone in that group still on track to be vaccinated by the end of the month?
Thank you, Matt. And I do have Chris Harrison's on the line with us as well. I'm going to ask Chris to also comment, but we continue to feel that we are on track to finish the 1A group, at least with first doses, or at the very, very least, scheduling of clinics for first doses by the end of the month. But Chris, can you give any more specific detail on the tiers within 1A?
Sure. Thank you, Commissioner. This is Chris Harrison. We have, in terms of the first tier, which is acute care and skilled nursing facilities, we have completed that tier. So all skilled nursing facilities have gotten their first, the offering of their first doses. In terms of the second tier, the systems have been able to vaccinate their acute care staff. We are in the process of continuing to vaccinate our assisted living, and that's part of why of the 60,000 doses allocated this week, not all of them are available for things such as the pilot, because we still have doses that are going to make sure that our assisted living elders are getting vaccinated. And then in the third tier, we have the additional healthcare workers, a number of which have gotten vaccine, but not all. And then we have our group home residents. So yes, the goal is that we will complete that by the end of the month. However, this addition means that may take a little bit longer, because we are putting some of the vaccine that would have exclusively been for phase 1A, we're expanding that to other populations. But we are on track with all the vaccinating that's happened up until this point. We're at where we thought we would be.
Okay, so I'm thinking of, dental clinics, mental health clinics. I know they are part of the 1A group. I think they're in tier 2 or 3. I'm not looking at the information right in front of me right now. So you're saying could they be delayed even into February, given now that more Minnesotans, particularly those over 65, are eligible?
We are continuing to allocate vaccine for phase 1A. And so even as our partners in the health systems are expanding, they are also continuing to vaccinate in phase 1A. So the idea is that they'll be able to utilize all the doses in a more expedient manner, more efficiently. But the priority is still to vaccinate for phase 1A. And it really depends on the region in terms of whether or not the groups that you mentioned, dentists, mental health providers, they're in the third tier, whether or not they've been offered vaccine. In some regions they have, and in other regions they're still working on that.
Okay, thank you.
Your next question comes from the line of Mr. Matthew Gary of Foreign News Service. Your line is open. You may ask your question.
My question was essentially already asked and answered, but thank you.
Your next question comes from the line of Mr. Theo Keith. Your line is open. You may ask your question.
Hello. Yeah, you're going to have some unhappy people at dentist offices and home health care workers, et cetera, who thought that they were in line to get a shot, at least by the end of the month, their first shot. And now they're hearing, oh, there's going to be some new people who have moved ahead of me, and now I might only be scheduled by the end of the month, but I won't get the vaccine until next month. What do you say to them?
Well, this is Commissioner Malcolm. I'll start, and Chris, or certainly Governor, if you have comments too, or maybe Andrea, as our healthcare partners are assisting in trying to accomplish both of these goals. We are collecting data. As Chris mentioned, there's some regional variability in how far the current vaccination priorities have been accomplished. So we're trying to find out, more precisely how many of the providers, the very important providers in Tier 3, how many of them remain to be vaccinated, and we're working on specific communications and outreach strategies to make sure that we know where they are and we know how much vaccine is needed to complete that. And so that does remain a priority in these next couple of weeks. Chris, do you have anything to add?
Commissioner? Yeah, I'll just say that you make an excellent point, Theo, but the bottom line is that no matter what we do, people will be and are angry. When before the federal government announced last Tuesday that they wanted things to open up, we had been getting a great deal of messaging from people saying, why haven't you opened it up to 65 and older? Once the federal government made that announcement, that put us in a challenging position. And so there are just not enough doses for everyone who wants to be vaccinated. So I absolutely hear what you're saying. And we want the people that are in phase 1A, Tier 3 to know that they are still being prioritized. But we are in a tough position because there's an expectation now that many, many more people will receive vaccine. And as you've heard everyone say, we're only getting 60,000 doses. And that puts us in a really difficult position. But our hope is that by expanding, we'll be more efficient with all the doses that we do receive so that there aren't any doses that are, waiting to be administered.
What's your best guess as far as when you might get more than 60,000 a week? I mean, is it going to be all the way up to potentially the end of February when the Johnson & Johnson shot comes online? Or are you hearing potentially it'll be sooner than that?
Go ahead, Chris. Okay, I was just going to say, from what we've heard from our federal partners so far is that we should expect about this same level for at least another few weeks. But I would also, I know the governor's on calls all the time. I don't know if he's got anything he'd like to share.
Well, Theo, we don't know. And I'd just like to note that this question you asked, first of all, is right, of trying to get those out to folks. And again, these vaccines can't be broke out of the packs they're in. Once they're broken out, there's a limited use time. Dentist's office and some of those providers in areas, remoter areas, by being deliberate on that and walking through it when the guidance was first put out, that drew the stories that were too slow in getting these things out, and that we should, instead of waiting to try and get all those people, we should expedite that to others. So I'm just clear that there's probably no win in this, but again, you hit on the last part of this. The way to fix all of this, get more vaccines. The federal government should have planned accordingly. They should have had the 50 million they promised us that are gone, and they're telling us now, and I am taking them at their word, but trust but verify, 100 million doses out in the first 100 days. We can usually extrapolate from that about 2 million is ours. If that's true, in the first 90 days, we could work through this new section that we have, as Jan put out. But I think people need to start thinking about the math on this. We in this country need to be vaccinating 4 and 5 million people a day. And at that rate, we're still months away. So I think expectations that have been set around this have been, obviously, they were not correct from what we were being told. Going forward, I assume we're going to get more, but it's still going to be a challenge. And there are trade-offs in this. Again, for us to wait and work all the way through 1A, 1B, and 1C without expanding, even if the federal government had not set it and set those expectations, Minnesotans had that expectation. The question that got asked about teachers. So this is going to be a challenge. What we really need, though, and I'm grateful for this, is seeing that whole infrastructure, folks like Andrea on here, folks like the VA, Indian Healthcare, and others, picking up different pieces of this.
Okay, thank you.
Your next question comes from the line of Ms. Caroline Cummings of WCCO. Your line is open. You may ask your question.
Good afternoon, Governor. My question is about any estimate of how much more vaccine you might anticipate in the coming weeks. It sounds like the rate of 60,000 per week is going to be at least for the foreseeable future, but I know Secretary Azar said last week that in the next 2 weeks, they were putting states on notice of recalibrating their data to make it the most accurate and would distribute vaccines under the new 65 older rule by the pace with which the vaccines were being distributed, as well as the share of a state's population that's 65 and older. Of course, the Trump administration is outgoing here, but I'm wondering if you had any sense of if that's going to continue what he said about how it's going to be allocated, and if you have any sense at all about how much more vaccine we should expect to get in the coming weeks.
Yeah, well, first of all, Secretary Azar is done in 44 hours. And after what he did last week, I'm just going to quite honestly say that I'm ready to get moving on here. With that being said, I think we're going to have to, and we hope for, as Jan said, I'm on the phone daily with folks from the incoming Biden administration. We don't yet have a good idea of what they're going to give. They need to, and again, I think For the folks out there who are wondering why transitions matter and why access to data during transmissions matter, many of them are running blind and they don't know. They don't have a sight picture into what we have or what decisions were made. I think it's safe to say that none of the things that Secretary Azar said are going to happen, and that there will be a recalibration of this, and it looks to be in conjunction with the states. And what we're saying is you heard Ms. Walsh say, you give her more, she can get them out, and she can get them out in a day. We're saying the same thing, and we're proving it to them with these pilot sites to show that whatever you give us, and we're at the point now with where the expansion is and what we are going to validate these sites over the next few days, that by next week, my hope was, just to be candid with you, I was hoping we were going to get a double allotment this week of 120,000. I think we're talking at that type of scale, but I don't have any idea at this point, and no one is putting that out. And just to be clear, we're having a very difficult time for the incoming administration to be able to understand what is there. Now, here's the saving thing. There are career public servants, civil servants who are at HHS, who are at CDC. Those folks will be able to keep things moving so that we don't have this drop off. But I would remind all our listeners, this inability to communicate during this transition period is dangerous. It's dangerous because it leaves us with these very questions. And you've got governors across the country giving this exact same answer. I don't know exactly how much we're going to get or when.
Your next question comes from the line of Mr. Tom Hauser of KSTP TV. Your line is open. You may ask your question.
Hello, Governor. I appreciated the Springsteen reference earlier. Just thought I'd tell you that. Also, getting back to this communication about the number of doses. Last week, you were angered by that Washington Post report that there were not going to be second doses available. Pfizer later on Friday said that's not true. They've been holding those doses back, and they are available. Does that make you more comfortable that we're at least going to be on the pace that we are and not falling behind, as I think you feared on Friday?
Well, yes, I do feel a little better. And in fact, I knew, talking to the governor of Michigan, that Pfizer's warehouse had those held back, had those in Michigan. The problem was, though, the federal government did not request them. I can't order them from Pfizer, and I can't get them here. I also have heard, and I haven't been able to confirm it, but that Pfizer was waiting on the federal government to purchase them, and in the meantime, they sold some to other countries. I am hopeful that the use of the Defense Production Act, some of the things that are out there, that they can ramp it up. I think here in Minnesota, we're just trying to control what we can control, and that's the ability of this entire vaccination ecosystem that people need to think about. This isn't the state setting up tents and giving them to everybody in Minnesota. We're not reinventing the wheel. Andrea Walsh and Health Partners can do this just fine. So can Mayo. So can all the others that are out there across the state. But I am concerned that those things weren't purchased or put into the queue, and that we were being told they were there. Now, the good news is it may be this way, Tom. It may be that Wednesday at noon that the new incoming Secretary Javier Becerra releases those immediately, and we get a call by Thursday night that our next allocation for next week is increased. If that's the case, the thing I need to be able to ensure Minnesotans is when those flow into the state, they flow right into arms as quickly as possible. And that's what this announcement is meant to do.
And then finally, somebody had mentioned on Twitter, of these 9 sites that you're opening, somebody had mentioned none of them are in Minneapolis or St. Paul. Is that true? And why is that? And then as a parallel to that, how long until maybe you can start vaccinating in CVS's or Walgreens or wherever people ordinarily get vaccines for things like the flu?
Yeah, I talked to those folks. I'll maybe let Jan answer that one. I will say we have site systems set up because of the ability to manage them, flow, security, sad state of affairs. But after the 6th of January, we take that very seriously. We have sites in Hennepin and Anoka. but we're also in Lyon, Olmsted, Nicollet, Stearns, Pennington, St. Louis, and Otter Tail. And I think the idea here is that my pledge is every single Minnesotan needed access to a test, no matter where they lived. Every single Minnesotan needs access to a vaccine. But there are sites in Hennepin and Anoka County that will serve this area. But again, with an area of this high a population, it's going to be really exacerbated in high population density areas. And again, Jan, I don't know if you want to, it's by the time we get to that, I guess that routine vaccination, like flu clinics and stuff like that, you know, I don't even know if I can look that far out. I'm guessing summer where you're looking.
Okay,
Hi,
go ahead, Commissioner.
Sorry, Tom. Yeah, I was just going to make one more point on the metropolitan areas. As we mentioned, in addition to what the healthcare systems have been getting for 1A, we are also going to be making some direct allocations to community clinics and federally qualified health centers, which will help with some of the access in the metro area, particularly for some of our hardest hit populations. In terms of the broader community vaccination with community pharmacy partners, I mean, they are involved in the planning for this ecosystem that the governor refers to. And, you know, as we get into broader population immunization, you know, again, we think, you know, having people connect with their regular source of care is optimal for a lot of reasons. But for folks either without a regular source of care, we do see pharmacies playing a role in as we get, you know, further into 1B, which again, unfortunately, we don't know enough today to really say a lot more about the rest of 1B or beyond, and we expect that could be changing significantly with federal guidance. But as we get into some of those populations, I think that pharmacies will play a role. But as the governor said, just sort of having COVID vaccine available kind of on the same basis as flu vaccine and other vaccines. I'm overdue for my Shingrix apparently, so I have to prioritize that too. We will be seeing that kind of community vaccination probably not until the early summer, as the governor said.
And Governor, maybe I misunderstood. Did you say something about security concerns about that's why there's not one in Minneapolis or St. Paul?
No, not because of that. Just we have to make sure that these sites can handle the amount of people they have. Some of these sites across the country have witnessed some protests, but that's not because of why they're not in Minneapolis, St. Paul. It's just that all the thought that goes into them.
Okay, thank you.
Your next
Governor,
question comes.
Oh, sorry, Operator. Governor, this is Teddy. We are getting a little close to time here, so we might do.
Teddy, if our folks who are on with us, Andrea, Will, and Commissioner can stay a little while, let's take a couple more.
Okay, sounds good. We'll keep going, Operator. Thanks.
Your next question comes from the line of Mr. Bill Werner of Minnesota News Network. Your line is open. You may ask your question.
Well, I hope, Governor, that you are still with us, because this question is directed at you primarily. The president-elect has said 100 million in the first 100 days. There seems to be a fair amount of uncertainty here. You mentioned flying blind on the part of some of the transition folks here in terms of vaccine availability. Is 100 million in 100 days realistic, or don't we know? Because Americans can do the math, you know, of the 100 million in 100 days, they can do the math and figure out where they might be in line. Is that realistic, the president-elect's pledge to do that?
Well, I think so. When a president of the United States decides to make this the top priority, as it should have been last March, instead of telling us it was one or two people and it would go away, they can move mountains, and I expect them to. I do think, Bill, the thing that I hope Americans and Minnesotans are thinking about is 100 million in 100 days is not enough. It's still not enough. And that's the thing that I guess worries me, even at a best case scenario at this point in time, because we're behind the eight ball a little bit, that they're going to even have to ramp up even more. I'm hopeful with AstraZeneca, Johnson & Johnson, the views potentially of the Defense Production Act. But yes, I think President-elect Biden understands this. He said it, he better deliver. Because I think the one thing that, you know, Americans are pretty tired of is false information or claims that aren't backed up or carried on. And so I am hopeful. It's encouraging to me to see a president talking about COVID and then talking about a real plan, because I'm not telling any of you don't know anything different. But every time this has happened, we've been just heard, well, the states have to deal with it. The states just have to deal with it. Well, we can't manufacture the vaccine. So yes, I'm hopeful. I'm hopeful the 100 million comes. My hope is that they're lowballing and it becomes even more than that, because every single one of those doses is one step closer to us getting done with this.
Governor, have you gotten any sort of indication from the incoming Biden administration on exactly what their plan is? I assume we have a combination of a production problem and a logistical problem. Would that be a fair assessment? Have you gotten any sort of concrete plan from them? Here's how we're going to address the production problem. Here's how we're going to address the logistical problem.
Yeah, and they're doing really great. They're asking us, and then we turn around and ask people like Andrea Walsh about what can happen and go up back to the healthcare systems. Yes, it is a production piece of this, but then they're asking us. One is, as you heard Commissioner Malcolm say, the money to be able to do this, and then asking what kind of logistical support do we need to make sure we have that robust infrastructure. All states are different. You see us, this bizarre game of states getting compared to each other, and all states are very different. They're different in their population. They're different in their population density. They're different in their number of healthcare workers. With that being said, they're talking about and asking us, do you want us to support your sites that you're opening up, or do you want us to come in and have a federal site, or do you want both of those things to happen? And so I think there is plans out there. They're being very deliberate in getting governors on the phones together to talk about what we would see. We're coming to some conclusions together. So I think what you'll see, Bill, is a combination of support for the efforts that the state's already doing, not to reinvent the wheel, potentially some federal sites that could relieve some of the pressure from us. And then the real thing they need to do, and again, I'm going to go back to what Andrea said, she knows how to do this, just give her the vaccines. And she and others like that will do it. Give it to the federally recognized health clinics. Give it to the VA. They'll get it done. So it is both of those things, but I think it has far more to do. And I think this is what's so encouraging, asking states what they need out of the federal government to be good partners. We have not had that through this entire process.
This is Andrea. I just build on the governor's comments. I think Minnesota has such a strong track record of public-private partnership, and I think today's announcement is the next step in that. Creating additional points of access for vaccine is a good thing. We're going to need to vaccinate those 4.5 million adults in Minnesota who should get a vaccine absolutely as fast as we can, and the thing holding us back is access to vaccine. So if we can get vaccine from the federal government, I think that we can all be confident that between the health systems across the state of Minnesota, in partnership with these public health sites and in partnership with whatever the federal government brings to bear, the point is we need to move fast to get this pandemic behind us.
Thank you both.
Your next question comes from the line of Lula Ragus of KERR 11. Your line is open. You may ask your question.
Thanks for taking my question. We're getting questions from people concerning where Minnesotans can get vaccines. Can they cross a state line to get it in another state? If they travel to Florida and they had their first shot here, could they get their second shot in Florida? And is Minnesota giving vaccines to any non-state residents?
That's a great question, Jen and Chris. I'm gonna go to you because I have to say these things come down from CDC and change it, and folks like Chris Erzman and her team and the folks with the data have been planning for months how to deal with the second dose. So Jan and Chris, if you want to address those.
Yeah, I'll just ask Chris to comment. Certainly anecdotally, we do hear of people traveling from all over the place to try to get it. So Chris?
Yes, right. We're aware of people who have traveled to other states with this intent to get vaccine. We also know that there are a number of Minnesotans that winter in places like Florida and Arizona and are pursuing vaccination there because that is a temporary home for them. One of the things that we've talked about is the importance of that second dose. And so as people are getting, registered and are being given an appointment for their first dose, we are making the appointment for the second dose because we want to make sure that they receive their second dose on time. And I think, as you may be aware, people need to receive the same product for the first and second doses. So for instance, if you receive Pfizer for the first dose, you need to get Pfizer for the second dose. And they have different intervals. Pfizer is 21 days and Moderna 28. So there are things like that that I think make it more reasonable for someone to receive both of their doses in the same place, just so that they can assure that they are following the correct interval and that they get the same product.
Okay, thanks.
Your next question comes from the line of Mr. Jeremy Olson of the Star Tribune. The line is open. You may ask your question.
Oh, wow, we came all the way back around. I had a question about the distribution to schools. First of all, the press release said K-12, but Governor, you had emphasized K through 5 or early education. I was just wondering for clarity on which teachers were going to be getting vaccine. And then my other question is on distribution to schools. I mean, I received an email from one small school district that's going to get like 8 doses. To be more effective, wouldn't it be better just to take all the doses, do one entire district, knock out that community, and then move on to the next one?
It may, and then we'd be back in the situation, Jeremy, where we would be compared to other states for not getting it out quickly enough because you can't crack those vials open unless you have the set number of people. So yes, it's logically, as I think Jan summed this up right, logically a lot of it makes sense, but the reality of it is it's a little more difficult. And I might have Deputy Commissioner Mueller talk about how the schools are doing this, but we just need more vaccine.
But to clarify, is it K-5 or K-12?
Heather, do you want to tackle that?
Sure. Thank you, Governor. It is actually pre-K through grade 12. And then within that is a prioritization, looking specifically at your learning model, thinking about your elementary staff and staff providing school-age care, early learning staff and special education staff who are providing direct services. So the governor was right in really looking at that prioritization, but it really is a pilot for pre-K through grade 12.
Thank you.
Teddy, let's take one more if we got it. We came back around to Jeremy if anybody's got one final one.
You've been listening to the COVID-19 briefing where we learned more about the vaccine plans moving forward. Governor Walz says not only does Minnesota need more doses, but also more guidance from the federal government. He expects a plan to be announced within 48 hours, and that should help the Department of Health finalize its strategy for vaccinating people in the so-called Phase 1B. 9 vaccination sites were announced today around the state. Those are for people 65 and older, teachers, and healthcare workers. And just because you're eligible now does not mean you're going to get a vaccine right away. And the reason is there just isn't enough to go around. MDH is asking Minnesotans to wait for their provider or employer to reach out to them with information about when they can be vaccinated. As the governor just said, we just don't have enough vaccine. Stay with us here on WCCO and CBSN Minnesota for the very latest on the state's response to the pandemic.
I'm Dr. Mohiba Tareen, and I'm a board-certified dermatologist here to tell you about the new awesome treatment for skin cancer called superficial radiotherapy. This treatment involves no needles, no cutting, no scarring, and it's very well covered by insurance.
I chose SRT because I've had skin cancer before. SRT was so much better than having the traditional surgery. The SRT was great.
Tareen Dermatology has 3 convenient locations in Roseville by Rosedale Mall, Maplewood, and in Baraboo.
2020, you hid your smile. 2021, unmask the real you and enjoy huge savings plus a lifetime guarantee.
Going into Renew, it was really just a matter of I needed something that was going to last a lifetime.
We care about you, and we want you to be able to afford a healthy, stable, beautiful Sure Snap smile. Feel better, look amazing, and save up to $4,000. Unmask a gorgeous smile this year. Call now or visit renewmysmile.com.
Andrea, hi.
Hi.
Why'd you join?
Well, I sing.
Yeah.